Hello, I'm Dr. Logan, and I'm going to talk about some special cases where radiation treatment is used for breast cancer. And the situation I'm looking at today is when a patient has had a local recurrence uh, of cancer after previously having a mastectomy and having an implant placed. So, to review the baseline situation, it's where there's been an invasive breast cancer. A mastectomy's been done, potentially a skin and nipple sparing mastectomy, so there's a little bit of tissue left. And where an implant has been placed, whether it's been before that mastectomy surgery or as a part of the overall care plan with a mastectomy. And we're going to suppose that at the time of the initial management of that invasive breast cancer, that there weren't any lymph nodes involved. And then following over time, let's consider some later events that that in fact there is an indication of cancer in the breast region. Now, the breast tissue largely was previously removed, but there can be little bits around the implant, or cancer can come back more deeply in the chest wall. And let's suppose that more surgery has been done when the cancer has been found, but the implant is retained. And in that situation, you might imagine that there's not a lot of extra maneuvering room uh, to take an extra wide skirt of tissue. So the surgical margins could be what we call close. And just to look at that in more detail, uh, let's imagine that picture as a cross section where that blue is the skin surface and that orange is an area of implant to retain the breast appearance, even though mastectomy has been done. And then let's suppose that those little white dots show as a model where surgery is carried out. And the little purple spots are where there could be cancer. And you can see in both of those instances that just because the surgery line has to go uh, on top of that implant, and eventually, uh, considering the area at the top, the, there's not a lot of extra room to take a wider tissue. So the cancer cells in that setting could be fairly close to the edge of where the surgery was done. And whenever there's something close to the edge, you have to ask yourself, well, what could be on the other side of it? Could there be more cancer cells? And the margins might be reported as clear, but say within less than a millimeter. And particularly where the cancer is what's called non-invasive, that is, it can creep along just inside the ducts. Now, that's an area where one looks carefully at these close but not positive margins. And if we look at some general principles, if there's been a recurrence of invasive cancer after a mastectomy, it's treated first by removing the visible, detectable cancer, that is the site of recurrence, if it's feasible to do that. And then it's typical to add radiation treatment to the chest wall, that's the tissues left behind, and often to the regional lymph nodes. And just to look a little bit about why to do that. So the key idea is that one doesn't want the cancer to come back yet again. And radiation does provide some insurance against that possibility. So the idea of radiation treatment is that you have a machine like the one in the picture on the left. Then you have a region, which on those pictures shows uh, the left chest wall itself lower down, or the right chest wall itself lower down. And in the higher picture, we see the right chest wall and some adjacent tissue, which is the lymph node type tissue. So if you imagine high energy x-rays going into an area like that, if they encounter cancer cells, those high energy x-rays have not a perfect track record, but a very good track record of being able to get rid of those cancer cells. So we add radiation when there is a chance of having microscopic cancer cells, whether it's elsewhere in the chest wall, say nearby where it was initially found, or if we think it might be trying to track in little tissue fluid channels that run in a little meshwork in under the skin of the chest wall, or where we think that there's a chance that the cancer could be, if you will, hiding microscopically in some of the lymph nodes which are nearby to the breast. So, as far as details of radiation treatment, exactly what's involved, there are some other videos, and if you're going to see me, I typically will send you some links to those specific videos. And so, thanks very much for your attention.